Hello, I'm Loriann Putzier, co-founder and president of IntegraCare Corporation, and I'm here to share our COVID-19 weekly update for week ending November 13th, 2020. My message this week is a bit longer than usual, and I do urge you to tune in from start to finish. It is the time that we need alignment with our families and our team members. We need to take a step back, each of us, and commit to what matters most: safety for all. Today, I plan to share 3 things with you. Number 1, what is happening nationally with the spread of COVID-19 and what is the incidence rate in our markets? We all watch those newscasts and we read those same articles, and it is very scary that COVID is rising at astronomical levels. The U.S. alone reported 150,000 new cases yesterday, and Pennsylvania is following suit. For the 4th time in the last week, Pennsylvania set a record in terms of the number of cases reported. There were 5,488 new cases, which was 777 greater than the day before, for a total of 248,856 cases. This is reflected in the rise in local communities as well, and we track the incidence rate in the communities and counties where our communities are located. The benchmark for concern is an incidence rate that is approaching or above 5%. If you are looking at your screen, you will see a chart that shares the incidence rate at each county where we are located. And of course, I'm sure you'll see what I see. It is of great concern. It is a time of reinforcement on safety protocols and, unfortunately, restricted access. That's not what I want, but it is what is necessary. We need your help and your support now more than ever. Number 2, what are the testing results at our communities? So I'm sure you're wondering how that chart relates to our testing results. Well, let me start by saying and sharing the positive news that we are grateful that we are still COVID-free in 7 communities. Those 7 communities are New Haven Court at Clearview in Butler, Pennsylvania, New Haven Court at Linwood, Greensburg, Pennsylvania, Colonial Courtyard at Clearfield, Pennsylvania, the Pines of Mount Lebanon, Pittsburgh, Pennsylvania, the Woods at Cedar Run, Camp Hill, Pennsylvania, Magnolias of Lancaster, Pennsylvania, and Hunter's Woods at Trails Edge, Reston, Virginia. When you consider that these communities are COVID-free compared to that incidence rate chart, it is quite an accomplishment and testament to great teamwork and dedication by a lot of very good team members and families. Unfortunately, we do have active COVID cases in the remaining communities. Please note that what I am about to share is where we stand today, November 13th, as of 11 a.m. The testing results are coming in throughout the day, so situations do change multiple times, and we are working diligently to keep in touch with you and to provide you the most up-to-date information. As it stands right now, Colonial Courtyard at Tyrone, Pennsylvania. We had 1 team member test positive, and we reported that to the state, conducted 100% testing, which was negative. We have a second round of testing to confirm the negative results, and we are optimistic with a continued negative outcome. So we are encouraged that this community will be well on its way in the next couple of days. Magnolias of Chambersburg, Unfortunately, we have 14 residents infected with the virus in our senior living community. All are quarantined and all are being monitored very closely for pulse oximetry, their vital signs, and any changes in condition. We await test results from earlier this week on 100% of team members. However, as of right now, 7 team members are positive and another is presumed positive because of symptoms. Both are home and nursing their way back to health. We have no infected residents in memory care at this time. The team is reporting to state officials, working with the Department of Health and Epidemiology, whose response to us was that Franklin County is a hotbed for COVID-19. Please bear that in mind if you are a family member. Next, Colonial Courtyard at Bedford. Sadly, we have 51 residents confirmed positive for the virus. 19 team members tested positive for the virus. Most of the team members, fortunately, are asymptomatic. All teams, both Chambersburg and Bedford, are supported by the IntegraCare home office regional team leaders, and we are working closely with each of the communities. We are also working diligently with the Department of Health and the epidemiologist in Bedford. And actually, Bedford is another county where the incidence rate is exceedingly high, as noted in the chart that I shared. We are retesting the negative residents and the negative team members, basically to assure that negative result. Finally, Candlelight Cove in Easton, Maryland, today had 1 team member as a confirmed positive. As a result, we are 100% universal testing with all team and all residents, and we are working closely with the Department of Health. If you are a family member in one of the communities that is COVID-free, what I urge you to think about with these results in the communities that have COVID is that these things started with 1 infected person. And even with all of the safety protocols in place, the spread is fast and furious. And we need to basically stop the spread, prevent the spread. So, number 3, the thing I promised to all of you this week is, what is our appeal and our plan for the Thanksgiving holiday and taking your loved one, our residents, out of the community? We know that as the incidence level in the communities rise, so does the incidence level within the assisted living, personal care, memory care environment. We have surging virus levels in every county that we operate and a profound and pervasive fatigue with the protocols, not only at IntegraCare, everywhere. For months, the danger of the virus has been focused on by state and local experts. And in general, they have paid attention to large group gatherings. Now, experts are saying we need to be paying attention to small group gatherings among family and friends who may appear healthy and relaxed and therefore stop just a little bit short of implementing the full precautions. As the weather has changed and most of us are indoors now, we need to face the fact that we are sharing the virus among each other at our own kitchen tables. Public health experts advised us in the early summer that there would be a huge surge in the fall, and unfortunately, here we are. So, it is with this in mind that I begin to think about Thanksgiving and what we are planning at each community. So please sit back and really think hard about this as you listen. We care about having great Thanksgiving celebrations at our communities, and we also care tremendously about connections with you. Actually, just preparing this message made me very sad today. I urge you to consider all points to help us prevent the spread. We have great plans to make the celebrations for Thanksgiving very special for our residents and team members because, as we have discussed, this is an unprecedented time. Sadly, for the first time in our history as an organization, we will not be able to host guests and families together in our community for the meal or the Thanksgiving celebration due to the threat of spreading the surge in the virus. Knowing how sacred Thanksgiving is to all of you and how sacred it is in our American culture and how much we have all sacrificed for far too many months, please know how much I want you all to be together more than anything. At this time, I'm going to appeal to you and ask for your patience and support once again, as I have in the past. I am going to ask you to think about the incidence rates, the surging virus numbers, and the impossible case counts that we see as a real threat, not only to our team workers and their families, but to your loved one, our residents. And I'm going to implore you not to take your family member out of the community, out of the protection where they live for your holiday celebration. We see this current surge as a very real danger to keeping your loved ones, our residents, safe. We agree that all of this is ridiculously unreasonable, disappointing, and supremely frustrating. As reasonable people, all we can do is present our case to you and ask for your consideration to this imperative. If, in fact, your family decides that alternatively, you still wish to take your resident, your loved one out of the community for the holiday, we will work with you to prepare a unit in advance in our quarantine area in the just-in-case neighborhood where the resident will be quarantined upon their return under our infectious disease protocols for a period of 14 days, producing 2 negative tests before they return to their apartment unit. Please realize that this means your loved one will not be able to leave his or her unit for the entire 14-day period. There are also costs associated with the time in the just-in-case neighborhood, and I would want you to be aware of that. You will be getting a communication from your local community EOO to share what will be occurring for Thanksgiving at your community. We will celebrate all that is good at each community given our circumstances, and I can assure you it will be a special and unique celebration. That is my commitment to each of you. These unprecedented times call for unprecedented diligence and restraint, great restraint from all of us. We are working toward a better day and the restoration of our personal connections and your personal connections. Until that time, please help us safeguard our residents and team members and their families. We need you. You are an essential part of our team and great contributors to our safer place for all. God bless you all, and please practice your safety protocols. Thank you.
IntegraCare. Our mission is to improve the quality of life for our team members, residents, and their families.